Hello, everyone. As part of our C11 Cyber Symposium 2022, we're going to have a great interview with Dr. Mark Bailey. Dr. Mark Bailey is a specialist doctor in respiratory medicine and also a clinical informatician at the Gloucestershire Royal Hospital. And I have him here to talk to us about where innovation and education meet critical infrastructure an NHS roadmap in health tech. Mark, it's really good to have you here with us and as part of the whole C11 symposium. And we would like to start asking you, what do you think are the main challenges for health technologies in the UK?
God, that's a good question. And thank you, Tiago, for inviting me to talk. It's a really good question. There's quite a few challenges. I think the big topics are culture. We're not used to doing digital in the NHS or doing it perfectly or well. And I think funding as well. And I think you brought it up as well, educating people what technology can do instead of being a burden to work, like let's just digitize what we're currently doing, but actually doing digital to make things better. Now, funding is always going to be an issue in any setting, health or education and so on. And I think it's important to appropriate fund things. But I think we do spend a lot of money at the moment, for example, in the NHS on proprietary systems. And I'm a big advocate of open source, and that's what I'm currently trying to do within my department and in my trust, is trying to use more open source techniques, or at least build prototypes in open source. And as you're probably aware, if you do open source, you can build once and share many. So the NHS could share a lot of money by, instead of paying lots of different companies to do the same thing, building one thing that lots of different trusts can use on lots of different primary care settings and lots of different anything healthcare can use over and over. So there's money, I think, to be saved by learning about open source, doing things in the open source, and the NHS manual and NHS X and digital, which are now changed names, have been advocating for open source for a little while, and I think rightly so. There's, as I mentioned, also the cultural issues, and that's within the sort of clinical setting, the corporate setting, even in the digital setting. So I'm working currently in my trust in Gloucestershire with the digital team, and it's been quite an uphill struggle for us all to think along the same lines in terms of digital innovation, rather than just the sort of business as usual processes that we have within the trust. Yeah, I think that's my answer to that one.
That's really good. Those are very complicated challenges for sure. And it's interesting that you mentioned a lot about digital innovation and the power that digital innovation has. And how is your take in how specifically digital innovation can support the healthcare? Maybe you can think on some examples and how this can impact the NHS.
Well, we've had a Let's Talk Digital conference recently, which University of Gloucester very kindly housed and helped co-host just in March of this year, where we talked about digital innovation at the front line. We had people showcase their fantastic projects, talk about how they managed to do them, how they managed to navigate through the sort of bureaucracy and the cultural changes that was needed for that. And I think sharing these experiences with other people helps them sort of move things forwards and try and do innovation themselves. But also, I think getting everyone who has these ideas in the same room just so they can sing from the same hymn sheet together rather than screaming in a void to actually do innovation together is really helpful. And an idea I've had from that, along with one of my colleagues and friends, Helen Winter, who's the SWAG Cancer Alliance Group, so the Southwest Cancer Alliance Group clinical director, is about a sort of clinical informatics hub, an area for digital innovation, building things, well, building ideas that frontline staff have, building them at the front line and integrating them properly and thinking about the whole maintenance and funding and so on and things like that, and also scalability. And whether that's a Southwest hub, whether that's a Gloucestershire hub, so hub and spoke sort of thing, it'd be great to have that. And that's something I'm working, as you know, Tiago, with yourself, the university and the trust, and even the local integrated care system, the ICS team. A lot of people wanting to do these things. And I think COVID, as bad as it has been, the pandemic has shown people the light that digital can really make a big difference. And there's been the whole the COVID app that came out very quickly. There's pros and cons to it, and there was some pitfalls with its implementation, but that came out very quickly. And how data was shared to look at the pandemic and the spread of the disease using open source things, for example, open anonymizer, for example. Yes, digital innovation, I think, is a need in the NHS, and it's about time that we start doing it. And it has happened in clusters throughout the UK, but not as fast as I would like. And I would really love to have that happening here in Gloucester, in the southwest. And let's build a hub locally, collaborating with everyone, sharing with everyone, and see what we could do to help patients in terms of getting better care, and also helping clinicians, healthcare professionals reduce their workloads and improve their workflows.
That's brilliant, Mark, and indeed a very important area for innovation, and particularly in the healthcare. I think lastly, since you're talking about these innovation and education meeting together, how relevant do you think it is for universities and educational institutions, research institutions, to interact with the healthcare sector to develop these innovation or just innovative ideas?
Really good question again. Now, I can't remember who said this, but I'm going to quote this figure, that we need 6 times more clinical informaticians in the NHS in the next few years. So we need to get people educated and trained up to understand the technology, understand the cultural shifts, understand the strategies that need to be put in place. And I don't think there's enough courses out there at the moment. I'm currently a student myself on the NHS Digital Academy Digital Leadership course, learning about the sort of governance and strategy side of things, not really the tech side of things, though I'm doing a lot of the tech with my 2 computer sciences students, my 2 fantastic computer sciences students, Nick and Joe, on digitizing the lung cancer pathway. But there's, you need to understand the technology all the way up to sort of the high level sort of political side of things. And I think there's not enough courses out there. And at the moment, as you know, Tiago, that we're actually working at the moment on an MSc in health tech in Gloucestershire University. And I'm very excited, look forward to have that happen, having people building things from the front line, like I was saying earlier, things that will benefit people on the front line, benefits, patients as well. But yeah, we just need more education. We need more courses. We just need to educate everyone, and healthcare is digitizing. We can't stop it. It's going to happen, because digital can make things better, just as long as it's done with a user-centered mentality. And digital is going to happen, and healthcare is going to be fully digitized in next few years. We're going to have to accept that, but it's a good thing. We just need to do it the right way.
Brilliant, Mark. That's really good to hear. And yes, we are really looking forward to starting this masters this September. And as you mentioned, it will be a very good opportunity to put in practice all this stuff we develop at the university. We truly believe, as you say, that when we make the digital happen, like we discussed in the Let's Talk Digital event, which was brilliant, and hopefully we're going to repeat it again next year.
Definitely.
Yeah, it's good to make it happen, and that's the gist of these MSc in Health Technologies, as we're going to be doing from this September, where we hope that students will be able to interact as much as possible with the local NHS, so we can see this digital innovation happening and see it becoming a thing, hopefully throughout the UK. Mark, thank you very much for being with us in this video. And for all of you watching this, listening to us, we would like to invite you to our C11 Cyber Symposium 2022. Please join us for more in our Cyber Symposium.
Thank you very much.